In the UK, there are 1.6 million men with coronary heart disease and over 60,000 have a heart attack each year. Cardiac disease poses a real threat to men, yet despite the statistics, many still do not associate poor lifestyle with an increased risk. In response to this, 3 of the leading cardiac private hospitals in London, the Wellington Hospital, the Harley Street Clinic and London Bridge Hospital, have united to launch the Loveheart Campaign, providing education, advice and tips on spotting the risk factors of cardiac disease and tailoring your lifestyle in a way that boosts heart health whilst allowing men to love life.
Men have a main problem in the Western world with cardiovascular disease, which is a term covering really all things from coronary heart disease, typically presenting with angina and heart attacks, all the way through to high blood pressure, stroke. Also to be included would be other forms of cardiac disease, such as those that are inherited.
One of the most common cardiac conditions that affect men is an abnormal heart rhythm called atrial fibrillation. And this affects about 1% of the population and around 10% of the population over 80, so it gets more common as you get older.
Lifestyle habits are quite important in influencing the development of cardiac disease in men. Principally they include things such as poor diet, sedentary lifestyle, smoking, drinking too much.
We're often asked what men can do to monitor the likelihood of them developing coronary artery disease at home. Basically, they should be aware of their weight and to ensure that they're not overweight. If they have any undue concern, in particular, for example, if there's a family history of heart disease, they should seek medical attention to determine if they've got any predisposing factors, for example, a high cholesterol or high blood pressure.
Key foods that are problematic for men in terms of heart health are foods that are high in saturated fat or trans fats or salt. So saturated fat comes from animal products. So it tends to be things like fatty meats or processed meals, ready meals, a lot of convenience foods and snacks, things like crisps and chocolate. Your favourite foods can still be included in a healthy, balanced diet. It's just about how you prepare them and how often you have them. Take, for example, steak and chips. Can still be enjoyed. Just choose a lean cut of meat, cut any visible fat off it. Try to cook it without adding extra oil, so try grilling it or dry frying it. Alcohol consumption is often overlooked by men in the UK. They don't think about how many units they're drinking, how many calories it contains. It's recommended that men have no more than 3 to 4 units of alcohol a day, and a unit is about half a pint of beer. So if you think of a pint of beer that you have in the pub on a Saturday night, 2 units in each pint, how many do you drink? There's also at least 180 calories in a pint of beer, so it all adds up, leads to weight gain, increases your risk of heart disease. To try and reduce your alcohol intake, try to choose social occasions that don't always revolve around the pub or the bar. When you are on a boys' night out, try to choose smaller drinks, so go for a half pint instead of a full pint, or drink bottles instead of pints.
Smoking is especially important in developing heart disease in men. A quarter of British men, or approximately, smoke, and therefore it's a big problem nationally. It causes the problem by affecting the lining of the arteries to the heart and actually the arteries throughout the body, leading to the deposition of cholesterol plaques or atheroma, so-called hardening of the arteries, increasing the risk of heart attack and stroke.
When trying to stop smoking, there is, of course, the intermediate step of joining with fellow peers who wish to stop smoking in an organised group, or you can step up to seeing a smoking cessation therapist or going to your GP, who will direct you to more specialised forms of help that have very good success rates. The
typical symptoms of coronary disease are symptoms related to exertion, when the patient might get more breathless than they expect, but also could develop discomfort in the chest or even in the throat and jaw, often radiating down to one or both arms, but not always.
The perception is that chest pain has to be effort-related for it to be coming from the heart, but any severe or unpleasant chest discomfort of new onset should be seriously considered as a potential cause or a sign of underlying coronary artery disease.
Stress causes behavioural change. If you notice that's going on for more than a couple of weeks, it's causing you problems, and you can't change it yourself, then it's time to see a therapist to help you achieve the change that you want.